In general, since you're developing these relationships with patients, over a long period of time, and they learn to trust you and confide in you, in general, do you have any advice for how patients, maybe a newly diagnosed patient, can develop a good working relationship or therapeutic relationship with their provider?
Right. So first, you mentioned that the conditions that we treat usually require long-term management, right? So you got to find that provider whom you feel comfortable with, right? You got to find someone whom you feel like your personality matches with his or hers, right? Someone whom you can trust.
Right.
And we know that here at the Polyclinic. So we have, a group of very diverse, 7 board-certified rheumatologists. Because you might not like the first rheumatologist you see, and that's okay.
So you think, I've seen on social media or in person talking to other patients, they'll talk about maybe, doctor shopping or kind of going. So you support people maybe making sure that they find a good fit long term.
Right. So you gotta find someone who you trust, right? But trust goes both ways,
That's
right?
what I was thinking too.
So you gotta tell your doctor what medications you're taking, or what medications you are supposed to take, but you aren't, right?
Yeah. I remember when I first started being a chronic illness patient, I just wanted to talk forever to my doctor each time. I knew they tell you what time the appointment starts, but not when it ends.
Right,
so,
that's right.
And I think as the provider, maybe you have to kind of subtly end the conversation
Right,
sometimes.
and also I think you have to balance, hearing the patient, but also trying to find out information so that you can help the patient, right? Sometimes what the patient wants to say does not necessarily match with what the doctors want to hear for the purpose of, making a diagnosis.
That's so true. And I think on the other hand, as a patient, it can be confusing because I've had appointments where I've had things going on, not just my rheumatoid arthritis, but kind of unknown mysteries.
Right.
And I'll go through the whole history and I'll say something kind of offhand, like I didn't think was important. And then the provider might be like, oh, wait, no, that's really important. So I think it's hard as a patient, that wait, everything I say could be important. I don't have the medical expertise to know what's important or not.
Right.
But maybe the fact that I really want to get a dog, it's probably not important. But I might really want to talk about the dog.
Unless you have allergies, of course.
Yeah, that's true. No, I just remember I recently saw a provider and he was asking me so what are your goals? It was a psychology provider and I was like, I really want a dog. And so I'm like, maybe they had some deeper meaning of that, but I was also like, okay, maybe he means goals for actual therapy, not just fun goals. Are there any logistical tips or tricks you have?
Well, I think just being prepared for the appointment, right?
Yeah.
I think you have to have a goal. What do you want to get from that particular appointment? Because you're right, unfortunately time is limited, right?
Yeah.
But something needs to be addressed. Right? So, just being ready, maybe bring a list of your medications before you go to the appointment. Maybe, thinking about your family history before going on an appointment. Maybe asking your relatives, maybe your mom or dad got diagnosed with something that you just didn't know about.
Yeah, and I think I've noticed a lot of facilities recently will give you the intake paperwork earlier, which is so great. And I thought at first, they're doing this so that it saves them time, but it also allows you as the patient to not be so kind of on the spot, oh shoot, I don't remember, did my grandpa have basal cell skin cancer or melanoma?
Right.
You can have the time. So, and I know a lot of patients, I've tried a bunch of different approaches, but they might do, a list on their phone that they keep track of. I have to ask Dr. Gorman, and I just have a running thing that I edit each time I see her. She's my rheumatologist here at the Polyclinic. And so, I say, okay, I asked this one last time, so this time. So you kind of triage it yourself to say, okay, maybe put it in priority order. So maybe my number one priority is, look, my bottom of my foot is super inflamed right now, but my other joints are quiet. What do I do about that?
That's right.
So
I think that's a good tip.
Oh, okay. Oh, thank you. I'm here to provide tips and information. What are some things maybe you wish patients with arthritis or inflammatory arthritis-like conditions, what do you wish that they knew about rheumatologists? for rheumatology as a field?
Right, so one is that of the conditions that we see, they're diagnosed of exclusion, and usually there's no single blood test or exam finding to make the diagnosis, right? I think the other important thing is, especially with the advent of all the ads on TV, you know, a lot of the patients are really concerned about side effects of medications, right?
Yes.
When you hear the ads on TV, they go on and on and on, from infections to cancer.
Yeah.
But the vast majority of patients actually do tolerate their medications. And while side effects are potential, you know, what's happening, let's say you have rheumatoid arthritis, the pain and swelling and the inflammation in the joints, it's happening, you know, right now. It is very real, and it needs to be controlled.
That's so true. Actually, I didn't even know that methotrexate had this reputation for being this really difficult to tolerate medication until I was active on some social media groups, and I kept seeing people talking about the methotrexate hangover and the methotrexate horribleness, and I kept thinking, what are they talking about? You know, but it hadn't, because I try not to think about the side effects. I want to be aware of which would be the most potentially serious, of course. But it's kind of like, yeah, it's a little bit of a double-edged sword going on the internet, and it's wonderful to connect to other patients and not feel so alone and to get general advice, but it also can people's horror stories can scare each other off.
Right.
So.
And the good thing is we have so many treatment options. For example, for rheumatoid arthritis, that if you actually do not tolerate methotrexate, for example, you can be on other treatments.
Right.